Good afternoon. This is Gina Briscoe. We're going to be covering note-taking in the health sciences, and the objectives for this program include following review of the program. Students should be able to explain the rationale for taking notes, and they should be able to demonstrate effective note-taking skills. So let's start out and talk about why do we take notes. Why should you take notes? Taking notes develops a sense of listening, allowing the student in the classroom or the reader to recognize main ideas, to understand the purpose and organization of the material. The student's attention is focused on the lecturer or the textbook, thereby increasing concentration, retention, and understanding. Taking notes makes the learning process active rather than passive. Not only does the student record significant facts, but students hear the lecturer's emphasis, they hear their tone, and they see their expressions if they're attending a lecture. Lectures where you learn what your instructor thinks is important, and he or she usually makes up your exams, so usually that's important. Therefore, lecture notes provide the clearest indication of what the student should study to prepare for exams. Note-taking allows us to increase our memory. It allows us to minimize the rate of forgetting. Studies show that those that don't take notes forget 60% of what they learn in 14 days. Those that take some notes remember 60%. And those that take organized notes and do something with their notes remember 90 to 100% indefinitely. So studies show that note-taking does help us to remember. I would encourage each and every one of you to develop a process or system for note-taking that makes sense to you, because note-taking is essential to learning. So, when should we take notes? Notes are a record of your learning, so take them when you listen to a lecture, you read your textbook, when you watch a film. I can't tell you how many times I've noticed that students don't take notes while they're watching a video in the classroom. When you work in a small group, because your notes may not reflect all your learning. I encourage you, as you're working on a problem in a group, to write down some notes from your peers. You want to write down notes of all the information that you need to remember, but also your notes should help you to analyze and apply the information. So by having the notes there, you can recall what was discussed and then try to think a little bit harder and look at how you can apply that information. We're going to focus on one specific technique for note-taking, and it's called the Cornell note-taking system. It was developed by Dr. Palk. He created this system at Cornell University. This system is widely used at many universities, as you can see listed here, and it requires the student to review notes and think critically after learning has taken place. So not only is it a note-taking system, but it's also a studying system. And basically the Cornell note-taking system has you systematically record your notes on a format that's like this right here. Now you can draw on a piece of paper these lines and these tables and these labels, or you can do it with the computer, and I'm going to demonstrate how you will go about doing it with the computer. But you certainly can do this just with pen and paper. So now we're going to cover how you're going to set up your margins, insert a footer, insert a title, and insert a table. And if you are very proficient with Word, then you may not need this next piece of information, and just feel free to skip over it if you don't need it. So you want to go in and open a Microsoft Word document, and then you want to make sure you just have normal margins, and then you want to go in and insert a footer. So you want to go to Insert, Footer, and go ahead and type in your title for this section, and we're going to title it Summary. And I don't like how small this footer is, so I'm going to show you how to make the footer a little bit larger. So go into Edit Footer, and I like my footers to be about 1 inch. Okay, that allows a little bit more space down here to take notes. Then I want to insert my header or my title, and you can do this, just you don't have to insert it as a header, or you can, either one, it doesn't really matter. But I would here put the title of the lecture that I'm going to be studying, so I'm just going to make up one for you to see. And then I want to put questions here, and then move over a little piece and put notes. And now I'm ready to insert a table. So I want to insert a table, and I want my table to have 2 columns and just 1 row. And then I'm going to move this over like this. Now, if I wanted to carry these headers from page to page, I would Now we want to open up Microsoft Office, open up a Word document, and the first thing we want to do is just make sure our page layout's like we want it, and I usually just use the normal margins. Then I want to insert a footer into my page, and so I'm going to just choose a footer, and I'm going to title my footer Summary. And I like my footer to be a little bit wider, so I'm going to go to Edit Footer, and I'm going to increase my footer space there. Then I want to insert a header, and I want to type in whatever content the lecture is going to be about, so I'm just going to make up something here. Then I want to put questions, and then scoot over a little piece and put notes. Now I'm ready to insert my table. So I'm going to insert a table here. Go to Insert Table, and I want 2 columns and 1 row. I'm sorry, 2 columns and 1 row. Let me try that again. 2 columns and 1 row. Okay. Then I want to move my space here, make my question column narrower than the notes column. Now I'm ready to either type in the notes that I take in class, or I'm ready to paste in the notes that the instructor provides me. So I'm going to show you how to do that, and you probably already know how to do that, but I'm going to go through and show you quickly how to do that. So I'd go to my Blackboard shell, and I would find the notes for the material that I'm going to be studying that day, and I would open up my notes, and I'm just going to pick something here. And then I'm going to copy my notes. I'd copy every bit of them. And then I would go back to my page that I've created and paste them under the notes section. So you see here I've got my notes that the instructor provided, and then I have a space over here for questions. And certainly you can widen your table if you want a little bit more space. If you're putting your notes in a notebook, you want to be sure and leave room for your hole punches down through here. But now I would be ready to print this up and take it to class with me, or to take it to class with me like this on my computer. And I may choose to go ahead and add some spaces. Say the instructor just has bullets down through here, major extracellular cation. Well, maybe I want to add a space here so I can type something, or so that when I'm ready to write I can add some information. So you can work with that and make your space between each line however you need to do that for your class. So we've set up our page, we've pasted our instructor's notes on the page. The next thing we want to do is be prepared to take notes or add notes during lecture. So if provided, paste your notes in your right hand column. If you're reading before hearing your lecture, you may want to have those notes printed up if you have them, and have them printed up and add your notes as you're reading. If you're reading later, then you can go back and add your notes from lecture. But again, you might want to make sure you leave some spaces to add information from your reading. During lecture, you want to be sure, if you're using the notes that the instructor has provided, you want to be sure and underline, highlight, or star, whatever process you want to use to the key points that your instructor provides. I encourage you also to separate your slides by drawing lines between each slide, and I'm going to show you an example of that now. This is an example of note-taking where the instructor provided the notes, and so I pasted the notes in here, and each line that I drew during the class, I drew me a line. This shows separation of PowerPoint slides, and that's good for me personally so that I can understand the organization of the material. So drawing these lines, is helpful. And I'm going to go back to this slide in a few minutes and talk about some of this other. So what are some good tips for taking notes on the right hand side? Write only what is important. Listen for repetition, change and pace or volume from your instructor. When your instructor starts numbering things off or gives explicit clues such as key points, important points, things that you may see again. Watch for gestures or clues to the organization of the material. And look at the material being written down by instructors or shared in a visual manner. So a lot of times they're not going to give you these notes. They may write on the blackboard. They may write on the DocuCam. That's when you need to be writing down what they write down. You also want to add missing information. A lot of times your instructor will refer you to a table that's in your book, or refer you to material in your textbook that you need to review, so you want to add those pieces of information there on the right hand side. You want to add notes from your reading as well in the right hand side, the right hand column. And you might want to look at someone else's notes and add notes from others' notes. So what are some other good tips for the right hand column? Write things in your own words. Paraphrase what the instructor says. Write using abbreviations. Draw figures or diagrams over in the right hand side. Leave space where you can fill in what you might need later. Use bullets, arrows, anything that organizes the material for you in a meaningful manner for you. And be sure and write legibly. Again, you want to listen for signal words from your instructor when they say, here's a key point, here's a key concept. Anytime you hear the word safety in healthcare, that ought to be a red flag to you that you need to know it. Anytime your instructor uses the word important, you might see this again, you might want to write this down. Those are clues that you may see those on the test. So I wanted to show you how this example, noticing over here in the notes column, I wrote additional information. Now you can't see this with this copy because this copy copied it black and white, but I use a different colored ink. I went back and added this point right here into my Cornell notes from the textbook, and this ink is blue, whereas the ink that I recorded during the lecture is in black. That just helps me to remember where I got the information. So in this lecture, the instructor specifically said 60 to 100 beats per minute is how we see this blood flow through the heart, and that correlates with the heartbeat. But I wrote that down, because I heard him say that in a manner that made me think it was important. Another point that he made was that this electrical activity results in the PQRST waves on the EKG. So I added to what he provided. And as you can see, all throughout these notes I went back and added pieces of information that I thought was important. For instance, when he was talking about this renal compensation, he shared that as a result of renal compensation we see the patient's blood pressure increasing. Well, that specifically would be something I might see on a test question, because it's application of this pathophysiology. And so as a healthcare provider, I would want to monitor this patient's blood pressure. So that's how I would apply that piece of information. So I starred that. But all through this material I wrote notes, from the lecture, but you can see I didn't write a whole lot. You can see as he was talking about ventricular hypertrophy, I added, why do we see the contractility decrease? It's because the heart's stretched out of shape. I put here, with right-sided heart failure, I'm going to see pink frothy sputum. And here's an example of a drawing that I took from the lecture, and so you can see here this add some visual, but I did not have enough space to put it over here. I didn't save enough space over here to put it, so I ended up drawing over here in my left column. But adding those visuals to your notes is very, very helpful, particularly for the visual learner. The next step in the Cornell note-taking system is to summarize. Try to reduce the information into few words, as few as possible, and write in your own words what you learned in class that day or after listening to the lecture. So record down at the bottom a summary of what the information that was covered. And this helps you to see relationships between points and strengthen your memory. It prepares you gradually for exams, ahead of time. So by taking your notes and summarizing them at the bottom and putting them in your own words, it allows the mind to start remembering. And so I'm going to show you an example of that now. So you can see right here on this example, well, I've got 3 pages. I summarized down here at the bottom. Heart failure is the inability of the heart pump to meet the needs of the body. Blood begins to back up into the system. Heart failure is classified in terms of right or left, chronic or acute, mild or severe. So those are some notes that that helped me to summarize and remember the information that I recorded over here and that was covered in the classroom. And I try to do this on each page. That way it's breaking it into small pieces of information, which is better for your memory as well. So on this page you can see I listed compensatory mechanisms for heart failure include, and so I bulleted my own list because I'm like that. I like my bullets. And then I also included how I would apply this information to a patient. What does this mean to a patient? Because again, we're healthcare students. We want to know how we're going to apply the information we learn in the classroom. So I'm going to assess my patient for increased heart rate, increased stroke volume, increased venous tone. I'm going to watch this patient for retaining sodium and water, and watch them for their blood pressure increasing. That's how I'm going to know the body is compensating for heart failure. So writing your notes at the bottom, helps you to remember and condense and reduce the information into small pieces that allows you to remember these things. So, writing your notes in your own words and you want to do this as soon as possible after hearing the material. So as soon as you can, you want to go back and do this. You want to review what you wrote in your notes, write your questions in the left-hand column. That's the next step. That's step 4. And so looking at your material that you covered in the right-hand column, and then going back and writing questions in the left-hand column. That's step 4. As soon as possible, after class again is the point. You also may want to write questions that you have, that maybe you need to go back and look up in your book in that column. And that allows for quizzing yourself later on. So what types of questions should you place over there in the left side? Questions which are answered in the notes to the right. Questions you still need the answer to. Maybe questions you need to ask the teacher about or ask a friend about. Questions that you think the teacher might ask on the test relative to the material. And, how are you going to think in a higher level thinking? How can you apply the information to a situation, to a patient? Because, again, we're in the healthcare business. So what else can you place over there on the left-hand column? Key terms, vocabulary words or dates, diagrams or figures, reference pages. In your text, a lot of times your instructor will refer to a table while she's lecturing in your book, or a specific page number in your book, so you might want to write those down so you can go back and look those up after class. Perhaps you want to write the steps, in solving a problem. Notes to yourself about what you need to do with the material. Maybe you realize you don't remember lab values that the instructor's talking about, so maybe you need to go back and look at some older material, look up some foundational material. Step 5 includes reciting the information, covering up the right-hand column, and then looking at the left-hand column and trying to remember what's in the right-hand column, and then uncovering your notes and checking to see if you've got them accurately in your memory. This will help transfer ideas to your long-term memory. So let's go back and look at our example again. So you can see here my question that I wrote after class was, what is heart failure? And so when I'm studying the material, I would cover this up and I would try to answer that question. How does blood flow through the heart? Then I would try to go through these bullet points. What is, and that's my terms that are listed here. What are the causes of heart failure? How is heart failure classified? Who's at risk for heart failure? So you can see I've written questions for this material, and that'll help me to study. And so you can see more examples of that here. And more examples here. The next step is reflecting on possible test questions and marking unclear points. This helps make sense of your notes by finding relationships and order in the material. Try to put the ideas into categories and tie your old material to your new, because much of what you will find in the health sciences is that we're building upon building information. So try to tie what you learn in the classroom from your notes to maybe some material you covered in anatomy and physiology, in fundamentals, in whatever prior courses you've had. Think about which points will appear on your test and go back and highlight those in your notes. If points are unclear, then maybe you can go back to your instructor and ask questions before the next lecture, or email your instructor before the next lecture. Then also consider looking at your problem pieces resource. And I'm going to show you that here in just a minute. And consider what was not addressed during lecture, or what you didn't find in your readings, and maybe you need to search for more information. So I'm going to go to that piece here now. This is another resource for you as you're studying, particularly as you get more into nursing or EMS or whatever your program is. This is a resource to you to try to study all the different pieces of information you need to relative to diseases and alterations. And so if you can answer, define the problem, identify who has it, who is at risk for the problem, what are the signs and symptoms of the problem, what do you need to assess, what is the care relative to the diagnostic test, what is the medical treatment, what are the medications, what are the nutritional considerations, what are the complications, and what is the care as it relates to safety. If you can go through and look at all this information as it applies to alterations or diseases or medical problems, if you can answer these things, after studying, then you're probably going to do very, very well on your test. This sheet will be available to you all to print up to utilize as you get deeper into your program. This is not something for the beginning student to worry about, but as you progress through your program, this piece of information will mean more to you. And step 7 is the last part of the Cornell system, note-taking system. It involves reviewing your material. And this slide says if you spend 10 minutes a day, every day or so, in a quick review of your old notes, you will retain most of what you have learned, and you will relate the facts and ideas to present lectures and readings. So this means going back even, after you've finished the material and been tested on it, and looking at it again. So if you spend just a few minutes going back to old material and reviewing it, it will help you, particularly with your foundational courses, foundational information, and help you to be able to then remember it to use it in whatever you're studying at the moment. 10 minutes a day is not sufficient review of the notes, though, when you're preparing for a new test with new material. You will need to spend much more time with that. I hope this information was helpful to you all, and I wish you the best with your note-taking and studying and preparing for your test in the health sciences. This is the end. Thank you very much.